Every Friday, we are taking the time to answer your most pressing questions. You've got a lot of them about the coronavirus. At least 19 states and Washington, D.C. announced new cases of a mysterious illness in children that is potentially related to the virus. So this raises major concerns as the U.S. starts to reopen and President Trump pushes to open schools. CBS News senior medical correspondent, Dr. Tara Narula, joins us. I note the title change. Kudos to you, Tara Narula, on that. So before we answer audience questions, we want to talk about an alert from the CDC that has talking about a potentially deadly syndrome in children with coronavirus. What can you tell us about that?
Well, Gail, we've been talking about this for the last couple of days, and what they did is basically create a case definition. So we have a better idea of how to define cases. And that includes fever in children that lasts more than 24 hours, laboratory evidence of inflammation, clinically severe disease that requires hospitalization, and the involvement of more than 2 organ systems. In addition to that, the child would have to have evidence on labs of infection with COVID or previous infection with COVID or exposure in the last 4 weeks to someone with COVID. And finally, it has to be ruled out that there's no other possible alternative diagnosis. If you meet all of those criteria, you would be defined as having this multi-system inflammatory syndrome. And it's important because if doctors begin to report, if doctors can report this to state and local health officials, we can get a better picture of what this disease and syndrome really looks like.
All right, everybody's concerned about their kids. Heather asked this question for you. How and when will it be safe for our children to go outside on a play date?
I wish I had the answer for Heather, and sometimes the answer is we don't know. And unfortunately, in this case, we really don't know. You know, we're still talking about social distancing. We're talking about it in schools and in potentially summer camps. So the idea of really having kids in these close quarters right now is probably not going to happen, at least for the next several weeks, I think, to months. But it really remains to be seen.
Lindsay wants to know what kind of masks are best for kids, because I see parents outside. Sometimes their kids are wearing masks and sometimes they're not. So what masks are best for kids?
A mask that a kid will wear, Gail. So some of these homemade cloth masks are perfect. The CDC actually has a website. We went to it ourselves, and we used an old T-shirt. I have an example here. We cut it out, one where you don't have to sew, one where you can sew it, and it fits very nicely on the child's face. You can wash it. It's breathable, and you can use something like a T-shirt or a pillow or a blanket. You want to reserve those N95s and surgical masks for the healthcare workers. And if you make the homemade masks, the kids can decorate them. Important to note that kids under 2 should not be wearing a mask, just as a side note.
Yeah, that's what I was going to ask you. Do you think all children should wear masks? And you answer that. People are starting to think about school openings, although most of the schools are closed right now. But Myra is asking this: how can we safely social distance elementary school students, and how can teachers prepare for schools reopening?
Well, it's going to require a lot of planning and a lot of creativity, and we are seeing it done in other countries. One big thing is going to be staggering, so staggering arrival and dismissal times, staggering when kids, for example, go to the library or in the hallway or have lunch, and even staggering days when you have school. So some kids might go to school Monday, Wednesday, Friday, some kids might go in the morning or the afternoon. Then there's going to be redesign of classrooms so that you have the desks sort of all back to back, 6 feet apart, and even face shields on the desks. And finally, avoiding those large gatherings like assemblies.
All right. Thank you, Tara.